Good day, everybody. This is your boy Pros, and today we'll be talking on a very vital topic, which is very educational, and which all of you will benefit from it. And with me here is
My name is Oyina Imeka, a medical laboratory scientist with a histopath specialist.
So, speaking of cervical cancer, according to research and everything, is now a very risk growing factor in Nigeria today. So we would like to know, what is the word cervical cancer? People it is most affected, and regions that are commonly affected by this.
Okay, so cervical cancer is a malignancy or a cancer that affects the cervix, which is the lower part of the uterus that connects to the vagina. So most people affected are women within the age of 35 to 55, and we have 90%, or let's say 90% of cervical cancer affects middle to like low income countries or continents, Africa being one of them and Nigeria being one of them. So here in Nigeria, we report almost like 12,000 cases yearly, with 8,000 women dying yearly in Nigeria. So yes, it's quite common in Nigeria, and it is the second most common cancer amongst women, Nigerian women here. And 80% of them die because like they always present with late case stages. So yeah.
So what are the, now speaking of this, now there is no way we can talk about all this without having or knowing the causes. What are these causes? What are the things that lead to all these cervical cancers? Like, we would like to know, and I'm definitely sure the public wants to know, right? So we want to know, what are the causes of this?
Okay. So cervical cancer primarily is caused by human papilloma virus, HPV, and it is sexually transmitted disease. So in the case of cervical cancer, we have the type 16 and 18 of the HPV. There are other types of HPV by other strains, but the strain 16 and 18 causes cervical cancer. So normally, if you get infected with this HPV, your immune system, if it's strong, within 1 to 2 years it can clear. But if there's a persistent infection of HPV, then this cancer takes over 10 to 20 years to develop. If it's not well treated, it leads to cervical institute, where the cancerous cells are within the cervical lining, but they haven't invaded other deeper tissues. Then if it's still there and it hasn't, like I said, it's a very slow progressing cancer. If it's still within the cervical lining, it can still be treated. But if it hasn't been treated, then it enters the invasive cervical cancer, where this cancer spreads to nearby organs like the vagina and other tissues.
I must say, you are doing well. This is a very lucrative and important topic.
Thank you.
So, even speaking of these symptoms and causes and regions where they have been affected and commonly found, definitely there must be diagnosis for it.
Yes.
Yes, like how do most of the women affected by this need to know how their cancer or how the cervical cancer can be diagnosed. What are the diagnoses?
So over here in the lab, we have 3 diagnoses that I know of. We have the pap smear, which is the cytology testing that checks precancerous cells. Then we have the HPV testing. This one is with the use of it's like a high grade testing that it checks for higher risks of HPV. Then we have the visual introspection with acetic acid. This one is normally used in very low income countries, because I don't think any lab here in Nigeria uses that. It's normally the pap smear. So with these 3, I think you can use it to diagnose and check for your cervical cancer status. Yeah.
That's very, very, very good. So these are the major diagnoses in Nigeria.
Yes, these are the major diagnoses.
I believe with time there will be more advanced technologies that will help in our diagnosis. So, speaking of this, having said all this, what are, for those that are not privileged to access high facility in the country or outside, So what are the management or treatment? Definitely there must be treatment if there is diagnosis. So what are the diagnoses? Can you tell us or enlighten the public about treatments and management of cervical cancer?
So before we get to the treatment and management, I would first like to say that what's it called? Cervical cancer, we have risk factors that can lead to that. Do you understand? So there's early onset of sexual activities, there's smoking, which is also a risk factor. There are like immunosuppressed people like HIV patients and some other things. Like when we are talking about management and treatment, we have things like the LEEP, which is the loop electrosurgical, is a surgical procedure that uses electrical currents. Then we also have hysterectomy, where they remove your womb and other organs attached to it. I think so.
I want to say thank you. But before we close, as a health practitioner and someone of your kind and caliber that has been in the field, my chief. So, what are the advice you can give to the females? Because this is like a kind of, it primarily targets the females. Now, female disease is female sickness. So, what advice can you give to the public, those that are watching you out there? What would be your advice to them?
My number one advice is going to be knowledge is power, like we all know. So, the first thing is get yourself informed by, watching this video and subscribing. Then being sexually active doesn't mean you're promiscuous. It just means like you're sexually active. So you shouldn't be ashamed to speak to your doctors or speak to other people and let them know that okay, you're willing to, or you're having certain signs and symptoms and you want to like check them out. Number two is to get vaccinated. Like just take the vaccine, especially within the age of 9 to 14. Mothers, please vaccinate your daughters and get tested too. Go and take the pap smear or the HPV screening. That way you know your status. If you're a smoker or if you're immunocompromised, please try and get screened. Yearly, yearly. I think twice in a year or so for people that are immunocompromised and they smoke. So you get yourself tested yearly because you have a higher risk of developing that cancer more than non-smokers and people that are not immunocompromised. Then generally practice safe sex. Reduce your sexual partners. Tell your sexual partners too about it. That way they are loyal and to themselves. To practice safe sex, use condoms. If you can abstain, perfect. And just let people know that this is real, because it doesn't just stop at cervical cancer too. We also have people that suffer from genital warts, which is also connected to the same human papilloma virus too. So above all, just be safe and just let people know. Don't be afraid to speak up. Don't be afraid to let people know that this is what you're going through and this is what is happening. And yes, above all, just be a woman and look out for your fellow women too. Thank you.
Emphasis on that. Don't be afraid to speak up. If not, the main thing there is, from what my scientists have said, I doubt if it is a life-threatening one. Except you feel or make it life-threatening. So once again, I want to say thank you for being on our show.
Thank you.
Please, like she said, keep watching out, keep subscribing, keep sharing. It's one thing to have the knowledge, as another thing to pass it on to others. So we look forward to having you guys on our next show. Thank you. God bless you. And don't forget, health is wealth. Stay safe out there.
Yeah.
God bless.
Thank you.